I grew up in a small town in Indiana, and my parents were family practice doctors. And so growing up, just being a doctor made sense. That's what adults did. And fortunately, I enjoy it. The question I get asked the most is, how do you pronounce my last name? And it's pronounced Bhojraj. Most people call me Dr. B. I'm an interventional cardiologist, which means that I do general cardiology, treat people with conditions like chest pain or blood pressure issues, and I actually get to do the procedures on them, which involves balloon angioplasty or stenting. So I think inherent in cardiology is the fact that it's such an important organ that almost any symptom patients present with seems to be very concerning to them. I think for me, part of what I really need to do as a physician is to explain to patients exactly what's going on and give them that information. The fact that I like to build the relationships rather than treat the acute condition really is the central core to my philosophy of care. I understand that today there may be a problem, but I'm also thinking about my patients 10 years from now, 15 years from now, and trying to make sure that the treatments I give them today don't give us any difficulty or put us in a difficult position 10 to 15 years later. But then I also get to be the one that's fortunate enough to take care of things for them with procedures during emergency events or elective events. And I really like being able to take care of my patient top to bottom, and that helps because they have someone they already know and they already trust. There's nothing else in the world I would rather do than be an interventional cardiologist, and I think patients appreciate that. And I come in with a lot of enthusiasm and a lot of excitement for what I do, but at the same time, I try to balance that against the risks inherent with any procedure. So I'm not someone that jumps automatically to doing procedures. I want to make sure that therapy for each patient is individualized to that person. That may mean that somebody is a great candidate for a procedure, or it might mean that they might be a better candidate for medicines. So I really try to individualize the care to each patient and their philosophies as well.